Successful specimen collection starts with patient education. Because Pap test results can be impacted by the presence of non-cellular materials in the transformation zone, it's important to advise patients to refrain from sexual intercourse, avoid vaginal medication, personal lubricants, vaginal contraceptives, and douches for 48 hours prior to the exam. Likewise, it's important to avoid scheduling the appointment during menses. Helping the patient prepare for the exam will help to ensure a good representative sample is collected. Position the patient and insert a speculum into the vagina. Warm water may be used to lubricate the speculum. If the patient is uncomfortable, a small amount of water-soluble gel lubricant can be applied to the posterior blade of the speculum. Perform a brief visual examination of the cervix. If excess mucus or other discharge is present, remove it gently with a cotton swab or gauze pad. Cells will be collected from the squamo-columnar junction, or transformation zone. This is the area where the endocervical columnar cells merge with the ectocervical squamous cells. And it is also where most dysplasias develop. The Broom-like device is designed to contact the ecto and endocervix simultaneously. Collect the specimen by inserting the central bristles of the Broom into the endocervical canal, deep enough to allow the shorter bristles to fully contact the ectocervix. Push gently and rotate 5 times in a clockwise direction. Immediately rinse the specimen into the thin prep vial by pushing the Broom against the bottom of the vial 10 times, forcing the bristles to bend apart. Next, swirl the Broom vigorously to release additional cellular material. Safely discard the collection device. When the specimen is successfully transferred to the thin prep vial, tighten the cap until the black torque line on the cap passes the torque line on the vial. Record the patient's name and identification number on the vial. Record the patient information and medical history on your laboratory's cytology requisition form. In addition to the Pap test, specimens collected in the thin prep vial may also be tested for HPV, chlamydia, and gonorrhea. In fact, the thin prep Pap test is the only liquid-based test with FDA approval for Pap, HPV, and chlamydia and gonorrhea testing from the same vial. To order these tests,